and I am one of the recruiters here at Arnot Health. I work in the human resources office, and mostly what I do is recruit for entry level positions. But of course, we have a lot of other different opportunities. So, this is just some information on finding a career at Arnot. And with the pictures, you can see there's Arnot Ogden. That is one of our medical office buildings in the Horseheads office. St. Joseph's Hospital, then Ira Davenport. So if you're looking for a new career, I would highly recommend you apply to one of our many locations. So as I said, Arnott Ogden Medical Center, which is in Elmira, St. Joseph's Hospital, also in Elmira, Ira Davenport Memorial Hospital, which is in Bath. And then we also have many Arnott Health outpatient office locations. So some are located in Elmira, Horseheads, Corning. We even have one in Bath. So throughout the southern tier. So our mission is to partner with each person we serve in order to maximize their physical, emotional, social, and spiritual health. And Arnott Health's vision is to be recognized as the premier regional healthcare system, delivering high quality, safe, cost effective, socially responsible healthcare services to all that we serve. So currently we have a little over 3,000 employees within our system. So that's inclusive of our 3 hospitals and outpatient locations. And as of right now, we have about 250 job openings. So a lot of different variety with what is open. I will go over some of our current openings later in the presentation, but it's not just nursing or licensed positions. We do have a lot of entry-level clerical positions that you could consider. So just to kind of give you a brief overview of where you can apply. So actually recently we did update our application system. So this is a fairly new system, but the website is still arnotthealth.org/careers. And then as you can see, there is a search for a job link. Once you get to that web page, you'll want to go ahead and click there. And then what will come up is this page. So this is kind of our application system. From there, to search for a job, there's many different ways that you can do it and kind of narrow down your search to see what we have available. So one thing you can do is if you just want to maybe search for the type of job that you're looking for, you can go ahead and type in what you're looking for in that search bar. There are some keywords that come up as well. So, feel free to kind of just search around and see if we have what you're looking for. If that doesn't work for you, we do have these categorized. So say you're looking for something clerical. If you look under clerical, anything that's clerical would be under that. Entry level stuff, go through support services. So things like that. And then if you're
Megan,
more, oh, can you hear me?
sorry. Yeah, this
Go
for
ahead.
some reason we're not seeing the slides as they move.
Oh no.
I don't know. You probably are. You might have to unshare and share again for some reason. If not, I actually have the copy of the presentation. If you don't mind, I'll just share it with the individuals on this call if you're okay with that as well, if you can't get that going.
Okay, let's try this. Can you guys see that now?
Yep, we have searching for a job is up. Is that correct?
Okay.
All right.
Perfect. Alrighty. So the other thing you can do is, especially if you're more concerned about location, we can also have you search by location. So many different ways for you to go ahead and search for that job that you're looking for. So after you kind of select a job, the big thing to look out for, check out what the work hours are, shift, status, and just be sure that it meets your needs. So the example I put up there, if you're looking for part-time nights, choose a job that fits that criteria. So if you're looking for that, and you apply for a full-time day shift position, and you put down that your want is part-time nights, you might not be considered for that position just because it doesn't quite fit, our needs and what you're looking for. So just something to keep in mind. The other big thing is just make sure you meet the education and experience requirements before you apply for a position. Some of our positions do require, like bachelor's degrees, licenses, but we also do have a lot of positions that don't have a lot of experience or education requirements. So there's a little bit of something for everybody. And then the other thing that I would suggest is just to look over the job description. So with this move to our new system, we do have the entire job description listed on the job posting for you to take a look at just to make sure that's the right job for you. So if you're looking for more of a like sit down job to do clerical work, but maybe you're looking at a housekeeping job, might not be the right fit. So just make sure you take a look at that job description to make sure it fits what you're looking for. Okay, so this is just kind of how you would start your application. So once you find a job that you'd like to apply for, up there at the top of the page, you'll click the apply for job link, and then it will have you get to this page where you would just either log in. So with this being such a new system, if you've recently been employed with Arnot or applied, I would say in the past 4 or 5 months, you would just log in with your username and password. If not, just create a new account down below, and then it will kind of take you through those steps to create your account, fill out your application, and kind of move forward in the process. So some big things that I recommend with the employment application, just make sure that all your previous employment for the past 25 years is included on your employment application. This is a big thing just because a lot of your employment history does affect like your rate of pay, things like that. And don't fret if you don't have 25 years of experience. Just go as far back as you have job history. Just make sure every part of the application is filled out and is complete. And just ensure that your reference information includes up-to-date phone numbers. That way we can get in contact with references and keeps the process moving along very well. So just some things that recruiters look for in an application. So a lot of this involves work history. So making sure you have relevant experience. So, for example, even if it doesn't completely relate to the position, sometimes, like customer service skills, if you have past experience with that and the position involves customer service, we would consider that somewhat relevant experience to consider you for the position. We're looking at maybe no major gaps in employment, but if you do have a gap in employment, just explaining that very well. It doesn't necessarily disqualify you from a position. It's just something that we kind of look for and might want some explanation on. So no short-term employments, kind of hopping around jobs. Although, like I said, it doesn't necessarily disqualify you, just kind of looking for explanation. So things like, it was a temp position, definitely some acceptable reason for that. And then involuntary separation. So again, doesn't disqualify you, but something that we do want to take a look at, things like you were laid off, definitely not an issue. Just something, to be honest on your application about your work history. Um, we do also look for proper spelling, grammar, and punctuation. So just proofread your application or resume before turning it in. Um, the other thing, meeting all education, licensing, and certification requirements. So for those licensed positions, this is a big one. So if you don't meet those qualifications, we probably wouldn't move forward in the process. And then again, just fitting all criteria. So as I had said before, if this is a part-time nights job and you're looking for part-time nights or you're kind of open for anything, just making sure you meet that criteria. And like I said, applications are taken case by case. So just really reviewing that and making sure, it's complete and everything. So this is just kind of an overview of our recruitment process. Typically, we check on applications at least once a day to see if we have anything new. And then if the candidate meets all the requirements, their application gets sent on to the hiring manager. From there, if the manager is interested, we will set up an interview with the hiring manager. And for certain positions, we do some peer interviewing after the initial interview. If they would like us to make an offer, we do begin referencing checks and initial background screenings. And as for our referencing, we do require at least 3 references to come back. Once everything checks out, we make an offer. And then from there, we schedule new hire paperwork, drug screening, pre-employment physicals before you start. And then finally, the orientation process begins. We do have orientation either once or twice a month, but depending on the position, you can start before then. So this is a list of our high need areas. So I guess I won't read through the list, but as you can see, there's a wide variety of different things we need. So nurses, nurse aides, a lot of clerical positions, housekeeping, dietary, public safety officer, and we also do have quite a few temporary positions with COVID-19 happening right now. So a lot of clinical screeners to do swabbing tests for the COVID-19 test, and a lot of intake reps. So things like that are really what we're looking for right now. And this is just kind of a list of different ways we recruit. So we do go through a lot of local colleges. One example I can give is for our registered nurses. We do have contacts with Corning Community College, Elmira College. So definitely go through them for a lot of our professional positions. Sometimes we do use external recruiters depending on what the type of position it is, how hard it is to fill. And we also use websites, so different things like membership websites. So if it's a licensed position, for example, and they have a membership, we might advertise through there. We also utilize Indeed a lot. So that's pretty much what I had. Does anybody have any questions about anything?
So Megan, it's Laura. I just had a question. So for when you say the hiring manager, so if they get interviewed by their field of interest, so if they want to be a registered nurse on the PED floor, that's who would, the person in charge of that would be the one that's actually doing the interview processing. Is that correct?
That is correct. So the director of whoever the area is over would be the person that typically interviews.
Okay. And then I have another one. Do you guys currently, are you doing any in-house training? So for instance, if someone, maybe they want to do like a CNA type of position, but they're not certified for that, is there any programs that are still running? I know you had some pre-COVID, but are you still doing any of those like in-house training programs to get certifications?
I do believe for the certified nurse aides, I think St. Joseph's is running a class. I don't know if it has already started or it's going to start, but I do believe that they are currently doing that. And I know Ira Davenport in the past has done that through BOCES on their campus. I think that's still kind of in limbo due to COVID, but I know it's definitely something that is still being worked on, and we do like to do those classes and run them.
Okay. I'll let some other people ask. Does anyone else have any questions? I have a bunch, so I'm just going to start to bombard you, Megan, if you don't mind.
No, that's great.
For the clinical, so for like the COVID screening and those types of positions that are kind of the temp but the high need positions right now, Is there any requirements for those, like any do certain certifications, any, previous employment that you're looking for them to have?
I would say for the clinical screeners that are doing the COVID testing in our drive-throughs, we definitely we can train anybody. However, I know it is desirable to have some sort of medical background. So, maybe you were previously a CNA or some type of personal care aide, something like that. So, definitely, desirable to have some medical background, but if it's the right person and they're willing to learn, we would definitely consider them for that position. And then as for our intake reps, definitely some clerical background would be desirable, but again, if it's the right person and they're willing, we would definitely be willing to, give somebody a chance.
And then I have one more question. So a lot of people who were previously maybe taking BOCES or different programs that maybe completed some of their hours did not complete their full hours, or maybe they've completed it, but because of the state of things, they were unable to take their actual certification testing. Would those individuals still be eligible for employment with you? Or, is it only certain positions because they still haven't got that state credential?
I believe if they do not have like their state license or certification, and they're interested in a position that requires that, I don't believe that they would be eligible for that position. However, I would recommend that maybe they reach out to us, and there probably are some positions out there that they could be considered for. And as soon as they get that licensure or certification, we can always consider them for any open opportunities we have at that time.
Thank you. I think unfortunately we have a lot of people that are in that kind of limbo position that are looking to go into the medical field and maybe just don't have all their certifications. So that's really helpful for them to know
Yeah.
that they still have a possible chance for employment.
Yeah.
Anything else, anyone?
Hi, Megan. This is Carrie Ann. How are you?
I'm good. How are you?
Doing well. Thank you very much for the presentation. It's very informative. Now, I know on your online application previously, I haven't had the privilege to see the new format that you've recently put out online. Are there kind of tips and tricks through the application? I mean, aside from filling it out completely, having your grammar, punctuation, typographical errors, and whatnot in check, like the uploading of some of their licenses, certification, diplomas, whatnot. How much does that entail within the application itself?
So, I do know like the actual application, um, it's tricky because I know it's fairly new to me too, and I've gotten some feedback, but I'm not as familiar as I was with like the older system, still trying to learn things. But I know it's pretty easy to be able to attach like resumes, cover letters, licenses. There's some free text boxes where the candidate can type out anything that they would want to let us know. So if there isn't a spot for it, there's always a free text box, or they could always just attach documents. But yeah, I guess that's all I really know at this point for things like that.
No, that's nice to know because I know with the other application it was hard to be able to elaborate on certain circumstances, so that free text box really gives the job seeker an opportunity to explain and, sell themselves to you, so to speak.
Yes.
And so the easiest way to fill out an application would probably be to visit your website. Is that correct? To kind of do the job search and application.
Yes, that would be the easiest way to do it.
All right.
Fantastic.
Well, I really appreciate your time, Megan. And this has been really beneficial. I do believe that this is a really in-demand field right now. So it's really important that we keep these places have good employees. I think we have a lot of people seeking positions that aren't sure about their qualifications at this point. So this has been really helpful, and I appreciate it.
Great. Well, thank you so much for letting me present. It was
Yeah.
great.